The acetylcholine. What is acetylcholine? Acetylcholine is a neurotransmitter. Okay. So, from the term neurotransmitter, what do you mean by neurotransmitter? It is usually a Viva question which is being asked in Viva. Neurotransmitter is a chemical messenger that transmits the signal across a synapse. Now, what do you mean by a synapse? Synapse is the gap between the nerve cell. Now, neurotransmitter transmit the signal, that is, these are the chemical messengers, from one neuron to another or from neuron to muscle or the glands. So, where are these acetylcholine neurotransmitters present? As we all know that there is a preganglionic fiber and a postganglionic fiber. So, in sympathetic as well as in parasympathetic, in both the cases, in the preganglionic fibers, acetylcholine is released. But in case of parasympathetic, the postganglionic fibers also release this acetylcholine, and that reaches the organ, and this organ has muscarinic receptors that receives this acetylcholine. But in case of sympathetic, we have alpha and beta receptors, and for that we have norepinephrine, epinephrine, and dopamine. We will read about that later on. So first we will see the synthesis of the acetylcholine. How is it synthesized? So this acetylcholine is usually synthesized in the neuron, majorly in the cytoplasm, the initial steps in the mitochondria of the neuron. So this is all about the synthesis of neuron. So what happens in the neuron? Acetylcholine along with choline, the CAT, that is choline acetyl transferase enzyme, acts on it and forms the acetylcholine. Now these acetylcholine, they enter the vesicle where it is stored. Okay. Now this fusion of this vesicle will be occurring, and how will this occur? When the depolarization occurs, sodium entry will happen, and that will act on the smooth endoplasmic reticulum. Calcium will be released, and from that this vesicles will fuse, and after that this acetylcholine will be released, which will act on this N receptors and M receptors on the postsynaptic organs. So this is the usual what happens. Okay, on this postsynaptic organs, there is acetylcholine esterase. Now, what does this do? This degrades the acetylcholine, that maintains the balance. Okay, because continuous acetylcholine will be released and effect will be produced on the organs. Hence, this acetylcholine esterases, they hydrolyzes this acetylcholine and degrades it. So, into acetate and choline. Now, reuptake of the choline occurs here. Um, there is a receptor and the uptake occurs. Again, this combined with acetyl-CoA and acetylcholine is produced. So what is the rate limiting step? Limiting step is the uptake, because if there would be no choline, the acetylcholine won't be formed. So what are the various drugs we will see? Before that, just read that rate limiting step is choline uptake. Now, we have read about this endogenous acetylcholine that is degraded by acetylcholine esterase enzyme that is present in the postsynaptic organ. What about the exogenous acetylcholine? Exogenous acetylcholine means when we give the drug of acetylcholine from outside into the blood. Now there, butyryl or pseudocholine esterases act. Okay, Bacche enzyme or Pache enzyme, that way you can remember. And where is the location? Blood and plasma, because this occurs in the blood and plasma, so they are present in the blood and the plasma. Then the drugs. What are the drugs used? Hemicoline, Vesamicol, Saxitoxin, pufferfish toxin, black widow spider toxin, botulinum toxin. Let's go to the mechanism. There we will see which one acts. So, uh, hemicoline. Now this inhibits the uptake of choline. Vesamicol. It inhibits the entry of the acetylcholine into the vesicles. Saxitoxin or pufferfish toxin. This inhibits the sodium entry, so calcium will be released. Because depolarization won't occur, sodium won't enter. Thus, the smooth endoplasmic reticulum, calcium won't be released. So fusion won't occur. So this fusion of vesicle is inhibited by botulinum toxin. And the black widow spider toxin, that leads to a massive release of acetylcholine. So these are the drugs which are acting here. So hemicolinium that inhibits the choline uptake, which is the rate limiting step. Vesamicol that inhibits the vesicle entry of acetylcholine. Sacidoxin or pufferfish toxin that inhibits the sodium channel. Black widow spider toxin that leads to massive release of acetylcholine. Now, therefore, the stores of the acetylcholine will be depleted soon. But all these are not used clinically. Okay. So botulinum toxin is the only drug which is clinically used in the patients. Let us read more about botulinum toxin. As we just read that botulinum toxin is the only drug which is used clinically in patients. This is produced by Clostridium botulinum, which is a anaerobic bacterium, gram-positive rod botulinum toxin. Now this produces type A and B toxin. Now that produces effect in humans, and this botulinum toxin is highly toxic to humans. Preparations. We have onobotulinum toxin A, ibobotulinum toxin A, inobotulinum toxin A. This is the trick to remember botulinum. Okay. Onobotulinum toxin A. Ono BTX-A. It is the short form for Botox, the famous brand. We know cosmetic world Botox. That is Ono BTX-A. Now, what is the property of the botulinum toxin? Mechanism of action. Botulinum toxin inhibits the release of acetylcholine from the neurons. That fusion, it inhibits that. Okay. What happens is this botulinum toxin that blocks the snare proteins, and these snare proteins are present on this vesicle. So whenever the calcium comes, it interacts with snare protein, but it is being blocked by botulinum toxin. Hence the acetylcholine won't be released. Now that leads to flaccid paralysis of skeletal muscle. Why? Because acetylcholine is useful because depolarization occurs, so muscle contraction occurs. Okay, muscle contraction occurs, but now this has been inhibited, so flaccid paralysis of the skeletal muscle. As I said earlier, botulinum toxin is most lethal toxin to mankind. It's most potent. Like 1 milligram of botulinum toxin can kill 1 million people. What is the route? It's always given local injection, but we add adrenaline or epinephrine first. Why? To reduce the systemic absorption into the blood, because adrenaline will cause vasoconstriction. So botulinum toxin won't enter into the systemic circuit. What are the uses? As we know that botulinum toxin inhibits acetylcholine. Acetylcholine causes muscle contraction. So wherever there is contraction, we can use botulinum toxins to cause relaxation. Like in case of muscle contraction, botulinum toxin is used for muscle rigidity or muscle spasticity, causes muscle paralysis, flaccid paralysis. So in these cases it is used. For example, eclasia. Eclasia means when the lower esophageal sphincter is contracted. It's present in contracted state. So botulinum toxin will relax this lower esophageal sphincter. Blepharospasm. Blepharospasm means the blinking of a muscle twitching of the eye. Then cervical or neck dystonia, that is spasm of the sternocleidomastoid muscle, that is torticollis. Okay, you can see like the head is tilted in children's, you can see that torticollis. Then squinting of eyes, then other spastic disorder means muscle stiffness. Acetylcholine also increases pain perception. So botulinum toxin can be used for migraine headache against this property. Then acetylcholine increases sweating. So botulinum toxin can be used for hyperhidrosis. In case of excessive sweating, we can give botulinum toxin. Cosmetic use, as we have already seen, like Botox, it is used for wrinkles like glabular lines to look younger, but facial expression become distorted. So these are the uses of botulinum toxin 1, 2, 3, and 4. Next is about acetylcholine receptors. What all we read? First of all, we saw what is acetylcholine, then about its synthesis, then about the exogenous, endogenous, then the drugs used, then more about botulinum toxin, then uses of botulinum toxin, now acetylcholine receptor.